Hey everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying yourselves, out there creating those great experiences in your life. You know, one of the things that people are concerned about when they come see us at the clinic, especially because we're chiropractors, has to do with their bone health. And two of the bigger concerns is osteoporosis, or two of the bigger concerns are osteoporosis and osteoarthritis. And sometimes the terms can be confusing to people. And on October 20th this month is actually World Osteoporosis Day. So I thought I'd just clue in on the difference between osteoporosis and osteoarthritis. Osteoarthritis is a form of joint wear and tear that happens over time, and it causes degeneration in that joint. It affects the space between the bones and also the bones, the ends of the bones themselves, and it can limit some function, it can create pain, it can interfere with reflexes, and can have some negative side effects on your quality of life. Now, what osteoporosis is a lack of density in the bones. The bones actually start to get brittle, especially over time. Now, the interesting thing with osteoporosis is that the peak bone density, the strongest that someone could build their bones, is going to happen by the late 20s or by the age of 30. And after that, for everybody, based on physiology, the bone density decreases over time. There's a slight acceleration that happens with women when they hit menopause, that they'll lose bone density even faster than men, but then into the late 60s and 70s, everybody catches up. So the goal in life to prevent osteoporosis is to build peak bone density by the late 20s into 30s. And that's why youth, especially adolescent females, once they hit puberty, have to consider how much calcium they're getting into their diet and how much weight-bearing exercise they're doing to help drive that calcium into the bones. There's actually a law in biology, in the human body with anatomy, called Wolff's Law, and it determines whether or not calcium is going to go in or out of the bones. And acidity can also play a role in that based on some of the research, and there are some other factors. But whether you're young and trying to build peak bone density, or some years have gone by and you're trying to slow osteoporosis, or maybe even treat it and try and increase your bone density, the key factors are making sure that your diet is healthy, you're avoiding the bad stuff, that you're getting enough calcium from quality sources, which is not always dairy. Dairy is not necessarily the best source. And that weight-bearing exercise is helping to put pressure on the bone so that that calcium is getting into the bones. So one of the things we do recommend for people is that they take a good quality pharmaceutical grade or nutraceutical supplement that will help get the calcium, magnesium, vitamin D, and vitamin K into their system. Calcium is not just enough. You need the other factors that support it to help make sure that it gets pulled out of the bloodstream and gets placed into the bone matrix. So there's kind of a strategy around that. It's not always as easy as grabbing something off the shelf. So a lot of people have heard that you need about maybe 800 to 1200 milligrams of calcium a day, depending on your age and your sex and your diet. But what they don't realize is you can't necessarily take that all at once. A lot of people will go out and buy 1,000 milligram calcium tablet and take it all at once and figure their daily equivalent has been, or their daily requirement has been met. But the body can only absorb about 400 milligrams of that at a time. So it actually needs to be spaced out 2 or 3 times out throughout the day to ensure that your body is actually going to be able to absorb that. And then you need those other factors along with it to help, again, pull it out of the bloodstream, make sure it goes into the bone. So there is a bit of strategy behind osteoporosis, building that peak bone density early on in life so that you don't have to worry about treating or dealing with osteoporosis later on in life. So visit us on the Facebook page, drop by, send us an email, go to the website, drop by the clinic anytime if you have any questions about osteoporosis or even osteoarthritis for that matter. October 20th is World Osteoporosis Day, so we're trying to spread the message, let you know some strategies so we don't have to have that pitfall in the future. Fractures that occur from osteoporosis are actually life-threatening when they happen later on in life and are a significant contributor to decreased quality of life when they happen later on in life, especially hip fractures in seniors. So it's an important message. Check out World Osteoporosis Day on October 20th. Let us know if you have any questions and how we can help. We're always here to help support those great experiences in your life, and I'll catch you next time.